I had to fight for my diagnosis. Like many women with PCOS, I always knew something was wrong. I brought it up with several doctors throughout my life, but typically with PCOS, it gets dismissed or you're just put on birth control.
Tai Adea has polycystic ovarian syndrome, a condition which can lead to rapid weight gain, insulin resistance, and infertility. Women like Adea, who struggle with PCOS, say they have long had to fight for recognition from the medical establishment. Now, Reuters has discovered that a growing number of people with the understudied hormonal disorder are finding relief in blockbuster weight loss drugs. An exclusive analysis of U.S. patient records was carried out alongside interviews with obesity specialists and gynecologists. The review of 120 million patient records by health data firm Truvada showed GLP-1 prescriptions for this group rose more than sevenfold in the U.S. since 2021. PCOS affects up to 13% of women of reproductive age globally. Symptoms range from irregular periods to unwanted hair growth and acne, to rapid weight gain and difficulty taking it off. The condition can also interfere with fertility, which has generally been the first time women get medical attention for their symptoms. Dr. Angela Fitch is the former president of the Obesity Medicine Association.
PCOS is certainly a common, condition of women. I think we probably don't know to the exact degree. A lot of people get diagnosed because they're seeking fertility, and a lot of these women have trouble with fertility. So I think it's probably underreported a lot of times, and so we should probably do better, within our healthcare system in terms of asking the questions, making the diagnosis, so people can understand the disease better.
Experts believe there is an interplay between PCOS and obesity, but the exact relationship is unclear. Research shows that patients with a family history of type 2 diabetes are more likely to develop the condition. Some studies point to high insulin levels triggering excess testosterone production in ovaries, interfering with fertility. Insulin resistance leads to weight gain, and additional fat worsens resistance, creating a vicious cycle.
Because women's health is kind of, not prioritized, it's often seen more as a fertility issue. So PCOS is only an issue when you're trying to get pregnant. And that's kind of just a framing issue because this is a lifelong disorder, right? Like whether or not I have kids, I will have PCOS.
Patients are typically prescribed older medicines, metformin for insulin regulation, orlistat for weight loss, and birth control pills for menstrual cycle control. But usage of GLP-1 drugs among women with PCOS has surged in the U.S. In 2025, 17.6% of women with the condition had a GLP-1 prescription, up from 2.4% in 2021, Truvada found. The company's review only included prescriptions through conventional healthcare systems, not telehealth apps or compounding pharmacies. And the specialists we interviewed say their patients have shown improvement on these treatments, though it's unclear whether any benefit is due to the weight loss or a more direct action.
Are there benefits, medically speaking, from a standpoint of the medication itself or the GLP-1 activation in terms of changing the course of the disease of PCOS, independent of the weight or independent of the weight loss factor? That's the knowledge we don't have today.
Early studies say GLP-1s seem to ease PCOS symptoms by reducing weight and insulin resistance. And some doctors have seen higher pregnancy rates for patients whose cycles stabilize, and have to caution against unintended pregnancies. Medical professionals say the lack of GLP-1 clinical trials for PCOS is a missed opportunity to address women's health needs. 35-year-old Adea has been taking the lowest dose of Zepbound for at least 6 months after failing to get relief on metformin.
I lost about 20 pounds, and and now my periods are regular, so I don't, right now, today, don't really have the symptoms of PCOS, even though it is a lifelong, genetic condition. I'm currently asymptomatic.
Currently, Eli Lilly, the maker of Zepbound, and Novo Nordisk, the maker of Wegovy, are testing their weight loss drugs for a wide range of conditions, like Parkinson's and substance abuse, but not PCOS. Novo did not comment on whether it would consider doing so. Lilly said it regularly assesses potential new uses for its drugs and will disclose any plans for trials when appropriate. At least a dozen research papers published since 2018, some on Novo's older drug Saxenda, show these weight loss medicines may help regulate periods and insulin resistance in PCOS patients. There is currently a clinical trial of 100 patients testing semaglutide and at least 6 others, but none are sponsored by Novo, according to a US government database.
I really wish I had these drugs when I was a teenager. And I wish that I hadn't, honestly, like wasted so many years trying to kind of figure out things that didn't work. It is why I like to speak about PCOS and GLP-1s. This condition is like not good to leave untreated. If you can nip it in the bud, nip it in the bud.